If we take any class of medication, antipsychotics, anti-anxiety medications, antidepressants, the pattern is the same. In the short term, these treatments are often very effective, but in the long term, they aren't. And in some cases, they're making life worse. If we look at, for example, studies that have been done on ADHD children treated with stimulants or Ritalin, in the short term, they are better and better responders than any other form of treatment. But in the long term, they fare less well than children who were never prescribed these medications. Another study showed that despite our ever-increasing reliance on antidepressants, the recovery rates and relapse rates are no better now than they were 50 years ago prior to the advent of these medications. And children with depression who are treated with antidepressants are 3 times more likely to convert to bipolar disorder than children who were never given these medications. And people who are randomized to stay on their dose of antipsychotic medications are less likely to recover from schizophrenia in the long term than people who had been randomized to a dose reduction or complete elimination of the drug. And I can show you more and more studies all highlighting this same bleak picture. So, pretty depressing. Is there another way forward? Almost 2 decades ago, my PhD supervisor at the time, Professor Bonnie Kaplan, told me about some families who were treating themselves with nutrients in southern Alberta, Canada. Now, they had bipolar disorder, psychosis, depression. These are serious conditions, and my education in clinical psychology had taught me that nutrition and diet were of trivial significance for mental health, and that only drugs or psychotherapy could treat these serious conditions. But she and others were publishing preliminary data in the earlier part of the century showing people getting well and staying well. And so I decided to study the nutrients, and that's what I've done for the last decade. In 2009, I received some funding to run a randomized placebo-controlled trial using minerals and vitamins, also known collectively as micronutrients, for the treatment of ADHD in adults. And this study was published in the British Journal of Psychiatry in April of this year, and here's what we found. Within just an 8-week period, twice as many people responded in the micronutrient group compared to placebo. Twice as many people went into remission in their depression in the micronutrient group. Hyperactivity and impulsivity reduced into the normal non-clinical range. And those who were taking the micronutrients were more likely to report that their ADHD symptoms were less impairing and less interfering than in their work and social relationships than people who were on the placebo. And 1 year later, those people who stayed on the micronutrients maintained their changes or showed further improvement, and those who switched to medications or stopped the micronutrients actually showed a worsening of their symptoms. And internationally, there have now been 20 randomized placebo-controlled trials. This is the gold standard that we use to make clinical decisions, showing that we can reduce aggression in prisoners, slow cognitive decline in the elderly, treat depression, anxiety, stress, autism, and ADHD.